Welcome back to Journey to 600. Today we're going to be talking about differential diagnosis for the hip. This is our agenda today. We have broken it up into muscle power deficit, mobility deficit, radiating pain, and movement coordination impairment. The gold, silver, and bronze is how Score Builders breaks down important topics. So gold is most commonly seen on the boards, then silver, then bronze. And then I threw in a couple extra like hamstring strain, impingement, and labral tear. There's really not a lot for the hip compared to the shoulder, but let's get into it. So what is a muscle power deficit? So this is when there's contractile structure dysfunction leading to weakness and pathomechanics due to overuse or trauma. Examples are Trochanteric Bursitis and Hamstring Strain. So for Trochanteric Bursitis, this is a pain syndrome based on the presence of pain at the greater trochanter. It can be due to the glute min bursa, glute med bursa, or glute max bursa. Typically, the mechanism of injury is going to be overuse of the hip abductors, trauma such as fall onto the greater trochanter, or a short IT band or glute. This is more common in females 40 to 60. They're going to have pain at the greater trochanter, radiating pain into the IT band, hamstring and buttock, pain with ipsilateral sideline, so when they're lying on that side of the greater trochanter. Special tests include side of the buttock, so this will be positive for bursitis, tumor, or abscess. This is performed with the patient in supine. You perform a straight leg raise, and once at in range, you flex the knee to slacken the hamstring, and then see if the hip can flex anymore. It would be a positive test if the hip cannot flex further when the knee is flexed, which is a non-capsular pattern of the hip range of motion, or you would have an empty infill. Intervention for trochanteric bursitis will be glute strengthening and flexibility, as well as core strength. Next is hamstring strain. So the mechanism of injury is typically an eccentric activity, or when that muscle is lengthening, or during rapid acceleration like sprinting or jumping. So they will have pain along the hamstring, weakness or pain with an MMT of the hamstring, loss of range of motion. You could see some ecchymosis or swelling in the case of a tear, and a special test would be hamstring provocation test. So this helps localize the area of the possible muscle strain. So it's basically an MMT of the hamstring where they are prone and the knee is slightly flexed, and weakness or reproduction of pain with internal rotation or external rotation will be a positive test. So if you internally rotate the hip, that would put the medial hamstring on top, and that would be positive for medial hamstring strain. If you externally rotate the hip, that would put the lateral hamstring on top, meaning that the lateral hamstring is involved. When you cluster the hamstring provocation with the hamstring MLT and resisted hip extension, that will cluster together to indicate hamstring strain. Intervention would be hamstring flexibility, glute strengthening, and hamstring eccentrics when you're in that later phase of rehab. Next is radiating pain. Radiating pain is numbness and tingling due to a nerve root or peripheral nerve compression. An example is Piriformis Syndrome. So this is typically due to trauma to the hip or buttock area, or piriformis muscle hypertrophy, or sitting for prolonged periods. They will have pain in the buttocks, tender palpate on the piriformis. Pain can radiate to the back of the thigh. They might have a range of motion restriction into hip adduction and internal rotation, pain with prolonged sitting. The special test will be piriformis test. And this is when the patient is in side lying with the top leg flexed at the hip and knee. You apply downward pressure at the knee to adduct the hip while stabilizing the pelvis with the other hand. So basically this is kind of stretching out that piriformis. So positive test would be pain or tightness in the buttock, or radiating pain down the leg. Mobility deficit. So that is when you have a range of motion limitation, which can lead to weakness and joint hypomobilities. Examples are hip osteoarthritis, which leads to getting or needing a total hip arthroplasty, and impingement. So hip OA is due to degeneration of the joint or wearing down of the cartilage. This leads to narrowing of the joint space and formation of osteophytes, typically due to overuse. Presentation would be C-sign pain, so deep pain in the groin, inner thigh, and buttock. Stiffness in the hip, especially in the morning. Pain with weight bearing. Range of motion restriction into hip flexion and internal rotation, thinking about that capsular pattern of the hip. Special tests include Faber and Scour. So Faber is performed in supine, and you place the hip into flexion, abduction, and external rotation, and you stabilize the contralateral ASIS while you push down the test knee. A positive test would be less external rotation compared bilaterally or reproduction of that pain. Scour is performed in supine as well, where you maximally flex the hip with hip adduction. Apply an axial force along the femur as you move in an arc from adduction to abduction. A positive scour would be deep pain in the hip or clicking and catching. Hip OA can be treated conservatively in physical therapy, but if they need surgical intervention, that will be a total hip arthroplasty. So total hip arthroplasty is going to be done in the case of hip OA or fracture. Rehab precautions for an anterior hip would be avoiding hip extension, adduction, and external rotation past neutral, avoiding hip flexion greater than 90, and avoid combined movement of the hip flexion, abduction, and external rotation. Posterior hip precautions are avoiding hip flexion greater than 90, hip adduction past neutral, and hip internal rotation past neutral. Impingement mechanism of injury is a structural abnormality with the femur acetabulum. They're going to have pain in the anterior hip or lateral hip, pain with walking and pivoting. It worsens with prolonged sitting. They can have a range of motion restriction into hip flexion and internal rotation. The special test for impingement is Fader, and Fader is also performed in supine, where you place the hip and knee into 90-90, then you adduct the hip with internal rotation. Positive test would be reproduction of pain or click. Intervention would be core stability, proximal strengthening of the glutes, and hip flexibility. Okay, our last category is movement coordination impairment. So that's impairments with either the passive or dynamic stabilizers of the hip. That includes ligaments, interarticular structures, motor control, and neuromuscular timing. Passive stabilizers are going to be hypermobile, so like those ligaments are overstretched, leading to hypermobility. And then those dynamic structures like muscles are going to be weak, so that leads to movement coordination impairment. An example would be a labral tear. So a labral tear can be due to degeneration, but typically it is due to trauma or overuse. There's a high prevalence in athletes or highly active individuals who are 20 to 40 years old. It is more common in females than males. They present with a deep pain in the groin or hip, history of activities such as twisting, pivoting, hyperflexion, or squatting. They can also report locking, clicking, catching in their hip. They will have limited and painful hip range of motion. Special tests would also be Faber, which we described earlier. So that can be for hip OA or labral tear. It's really what is the population that you're assessing in and what else in their presentation matches more for OA versus labral tear. Intervention is going to be core stability, proximal strengthening of the glutes, and hip flexibility, which is just like impingement. They have a very similar intervention. So here's our differential diagnosis chart to kind of help you. So things that are going to kind of help you identify what type of injury it is thinking about the area of pain, if they're tender to palpate anywhere or have any weakness, and some other characteristic signs or special tests. So for hip OA, we're looking for deep pain in the groin, inner thigh, or buttock, pain with weight bearing, and that morning stiffness, and capsular pattern loss of range of motion. Special tests we Faber or Scour. Hip impingement can be more anterior hip pain or lateral hip pain, and that the pain worsens with prolonged sitting. They have a special test, which is Fader. Hip labrum is going to be deep pain in the groin, which is similar to hip OA. Also, Faber is similar, but we're going to be looking more for the locking, catching, clicking of the sign that they're going to be report, or also looking at their age, which is not in this chart, but that labrum, if it's due to trauma, will be that younger female athlete. Trochanteric bursitis is going to be that lateral hip where that glute tendon is tender to palpate over the greater trochanter, and they could have some radiating pain as well. Their special test is going to be side of the buttock. Muscle strain, specifically the hamstring, then they're going to be having pain in the posterior hip with weakness of the hamstring. You could see ecchymosis, and we will do a special test of the hamstring provocation. Piriformis Syndrome is also posterior hip. They will be more specifically tender to palpate on the piriformis, pain with prolonged sitting, and they will have a piriformis test to rule in. Okay, first practice question. So the physical therapist for a college track team is evaluating a sprinter. 1 week earlier, the patient had to stop suddenly during a race because of sharp, severe pain in the back of his upper leg and felt a pop. The patient now reports pain with straight leg raise and ecchymosis. The most likely cause of this patient's symptoms is A. Piriformis Syndrome, B. Hamstring Strain, C. Labral Tear, or D. Hip Osteoarthritis. I'll give you a moment to answer. Please pause if you're not ready to review. So mechanism of injury we're looking at, they are running, felt a pop with sharp, severe pain in the back of his upper leg. So we're thinking, posterior leg, pain with straight leg raise and discoloration we're also seeing. So piriformis, we could be thinking because it's posterior upper leg, but not likely with this mechanism of injury at this acute phase. Hamstring strain, mechanism of injury sounds like a reasonable match. Straight leg raise would stretch the muscle, which would cause pain and have some discoloration. I like this answer, but let's keep looking. Labral tear, so that's not necessarily going to be posterior leg pain. It would be like deep groin pain, and it wouldn't be painful with straight leg raise, or you wouldn't really see any bruising with a labral tear. Hip OA doesn't sound like the age for this patient, college track team, and the mechanism of injury would be more degeneration, wear and tear, not that they were running and had a pop. So hamstring strain B is the best answer. Practice question number 2. A 25-year-old active female adult reports deep hip pain. She has increased her workouts and reports pain with deep squats. The patient reports catching in the hip. Upon examination, the Faber test was positive. Which of the following is most likely the diagnosis? A. Hip osteoarthritis, B. Piriformis syndrome, C. Trochanteric bursitis, or D. Hip labral tear. I'll give you a moment to answer. Please pause if you're not ready to review. So we're looking at age, 25-year-old, looking at female. Increased hip flexion when you have those deep squats, and reports catching in the hip. So positive Faber as well. That could be OA or labrum. So looking at the answers, I can probably be between A and D. Piriformis syndrome would be more posterior hip pain with numbness and tingling. Trochanteric bursitis would be more lateral hip pain. So then thinking back at the patient demographic, it's likely not hip OA, so D, hip labral tear, is the best answer. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.